First, we have a safety alert. The number of chickenpox cases in the upstate is rising dramatically. The South Carolina Department of Health reports we have 96 cases here. As you can see on the screen, the Midlands has 4 and the Low Country and PD regions have 0. So a far majority of those cases are here. Family Dr. Nita Bajor is joining us. She's from Oakview Medical Associates here in Greenville. So thank you for being here today.
Thank you for having me.
And I looked some more into these numbers. In a week, we went from 51 cases to 96. So it is a pretty big jump in a short period of time.
Absolutely. Very concerning.
So let's go over what is chickenpox, what are the symptoms?
Yes, so chickenpox is a highly contagious viral infection caused by the varicella zoster virus. And usually symptoms start about 12 to 21 days after contact with somebody with chickenpox, and they can range from main hallmark is a itchy rash on the body that starts mostly on the trunk, on the chest, spreads to the face, and then to the arms and legs, and then it's followed by blisters, which then go into several stages of healing and scab over, also associated with some fatigue, loss of appetite, and a headache.
And I know the vaccine is recommended, so at what age should you get it? And then my next question would be, what should you do if you got chickenpox as a child? Are you protected?
Yeah, so vaccine is highly recommended. I was just thinking the vaccine was licensed for use in the US in 1995, 30 years ago. So we have a whole generation of people that fortunately have not, on the whole, experienced chickenpox, but it's known to be highly fatal, and years ago a lot of people died from it. So it's important. The vaccination, the schedule is the first dose is given to children between 12 to 15 months of age, and the second one at 4 to 6 years of age.
And then let's say I had the chickenpox when I was a child. Do I need to get vaccinated, or am I protected?
So not necessarily. If you've had chickenpox, like I have also in my childhood, we have natural immunity. So there's a quick, easy blood test we can do to check our levels of antibodies, and then you don't necessarily need the vaccine. If your immunity has waned, so if the blood test shows you don't have a good antibody response, you can take another set of doses, which are given 28 days apart, 2 doses.
Now, what if you didn't get the chickenpox vaccine as a child, and then you also didn't get the virus, the chickenpox?
Then you must get vaccinated.
Okay.
So the schedule is 2 doses a month apart, 28 days apart.
All right, so talk to your doctor about that. Now, what are the dangers of getting chickenpox as a child?
Lots of dangers. I mean, way back when we used to see that, we used to get a lot of complications. So on the skin, the blisters can lead to secondary bacterial infections, staph infections. You can also have a brain inflammation called encephalitis, which was highly fatal. And then it can also cause pneumonias. So those are hospitalizations, dehydrations, and complications from that.
And I know that's some of the similar symptoms of the measles.
Exactly.
That's how somebody died recently.
Yeah.
And I understand chickenpox is worse as an adult. Tell me about that.
Yes, because adults who are not vaccinated have never built up that antibody response, so their system is naive. So if you get chickenpox as an adult, it can be the symptoms can be much worse. So it's important to get vaccinated. I think there's a lot of the gaps, vaccine gaps, and the vaccine hesitancy have led to certain populations not getting vaccinated. So these are adults that must seek medical care and at least have that discussion with your physician so you can know if that's right for you.
All right. Well, thank you so much, Dr. Bajor, for coming in. But yeah, again, chickenpox cases are on the rise here in the upstate.
Yeah, vaccines save lives.